and Brad, the two most famous physical therapists on the internet.
All right. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Oh, aren't you a little flamboyant
well,
today?
Bob, you know, I was feeling a little spicy.
All right, pump it up. Today we're going to talk about 3 best self-tests for meniscus injury and 2 tests to actually avoid. So why are you looking at me? You're the one that came up with this title.
Well, I was thinking of shoulder, but that's my next video.
All right.
Little
yeah, let's get back to the
thing.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free. We upload every day. And we are always giving away something, right?
Are we going to show it before
yeah,
we do?
We're giving away the merch here.
Merch.
So, you know, you can get our
merch means merchandise.
And
some people don't know that.
Got the ugly mugs on there. So we got some other ones too. We got a strong like bull. Marcus, maybe you want to put that one up again?
Yeah.
The strong like bull one?
Oh, yes. Yes.
I can't wait till mine gets here. I'm going to wear it all the time.
Yeah. Strong. Got to roll the R.
Yeah. Well, anyway, you want to show again where you go? Go to bobandbrad.com and go to giveaway section. It's right there. It also can go to Bob and Brad on Facebook. It's pinned to the top of the page.
Look at the pin.
All right, Brad, take it away. What are we talking about here today?
And this is as a therapist, when someone comes in with knee pain, which I had 2 people so far yesterday come in with knee pain this week. And of course, we want to try and determine, is it the patella? Is it arthritis, or is it meniscus?
Is it soft tissue?
Right, or is it soft tissue?
Yeah.
And when it comes to meniscus, and people ask, well, what is meniscus? It's the hardest thing for me to describe.
Well, it's the cartilage. First off, we can say that, right?
Right, but you know, it's not the cartilage that's
not the lining. Right, it's not the lining.
Right, so we've got Sam. Yeah, Sam will be, this is one of the best models that we have on the internet, in my opinion, of course. But if we look at Sam here, we're going to take the patella and the infrapatellar tendon away. Here's a nice little diagram. There's the ACL. And now if you look at this, we call this the medial horn of the meniscus. There's a posterior is the backside. And you can see it looks like a figure 8. Can you see that, Liz? And it helps like a cushion for the condyles of the femur to set into. It helps stabilize the joint. And if one of these get tore or ripped, they can fold over. The model here doesn't allow that, but if you can imagine this brown substance or tissue getting folded or ripped, it can cause a problem on how the joint articulates or slides back and forth.
I mean, it'd be like a rock in your shoe, basically. I mean,
that's a good analogy, Bob.
So,
wow, excellent. Do you use that with your patients to say an analogy?
Oh, sometimes, yeah.
I'm just wondering. You know, it's always nice to know how to describe things so people can relate. But one of the first things, now this is not one of the tests in the title, but one thing is ask yourself, or monitor, does your knee ever lock? Like if you're walking or going up and down stairs and it locks up and there's pain associated with it typically, but after you move it around a little bit, maybe take some weight off it, it frees up and then it's okay again.
Right.
So what's happening is that meniscus we talked about, if it's got a fold in it or a crease,
or a piece of it even broke off.
Right. It could be a floater. They call it a floater. Gets locked up physically.
In the wrong spot.
Right. And then it's like throwing some gravel into a bearing or a joint.
Yep, exactly. It's just not going to work well. And so that's a sign that you probably have a tear. You know, the fact also you want to look at, were you just involved in an accident? Were you just involved in an athletic injury? I mean, obviously that's when you want to start thinking about this. These do happen spontaneously, especially as you get older.
Right.
You're probably going to be more likely in the age 50 and above, but not likely to happen when you're younger.
Right.
I mean, unless injury.
Right.
So,
repetitive motion, that may be indicative of. Now, one thing about these 3 tests we're going to go through, you can do them by yourself. It's going to be more accurate if you do them with a therapist that has lots of experience, but you can try these and see if they're positive or negative. And even with an experienced clinician, studies show 45 to 55, 60% reliable. So, you know, these tests aren't.
Yeah, they aren't the be all end all.
Right.
I mean,
but they can give you some information.
They can give you a direction.
Right.
And if you and I think as you mentioned before we were talking, Brad, that if like all 3 of these tests are positive,
and you get that locking.
And you get that locking. There's a pretty good likelihood.
Pretty good sign. Yeah. The first one is, because I know they're waiting, we're babbling, Bob.
Sure.
Is the Thessley's test.
Okay.
Now, it's nice on this one on one leg. It's going to be on the one leg, and obviously you're testing the leg that's weight bearing. You're going to bend the knee, okay, from 5 to 15 degrees, so that's about there.
Not very much.
Right. And then you're going to have something to hold on to stabilize yourself. You know, I'm going to do it right here. You might need both hands, depends on how stable you are. And then you simply rotate, I should say, back and forth. And if you feel pain, clicking, anything of that nature, that would be a positive test. Now, it's nice you can do it with the good knee, assuming one knee is only one knee is suspect of it, and compare one to the other.
I like this test because it's very easy to do.
Right.
It's very easy to apply. Yep. And again, be safe. Don't, if that knee is bad, you could collapse.
Right. So, don't go right after it. Kind of work it slowly to begin with. The next one is the Childress test. Okay. I call this the duck walk.
Okay.
Okay. So you point your toes out, widen your feet about shoulder width, and then down like this, and then try to walk.
Aren't we a sight?
Yeah. If it's painful with that walk, that would be positive.
Sure.
I had one person, she was positive with this, and I had her do some exercises to strengthen the supporting muscles. And we came back a couple weeks later. I tested the duck walk again.
It was fine.
It was negative. Yeah.
Sure. Was it just pain she had?
I'm not sure if it was meniscus or not, but whatever or not, she got better.
Got better.
Life was good.
Right.
Then the Aegis test, and I'm not sure if I'm pronouncing that right.
EGES?
Yeah.
Okay.
This one, feet about shoulder width wide, and you're going to externally rotate or point your toes out as far as you can. Now, I do pretty good with this, but you got to keep your balance. You may have to hold on to something. And then you're just going to squat down as far as you can and then back up. Now, if you squat down and you feel some pain, some locking, whatever, don't go anymore. Watch out, Bob. You need something to hold on to.
Is this like a plie? I don't know.
I don't go there, Bob.
Yeah, all right.
Okay, so we go there, and then we go up, and then you also go internally rotate like this. And this is testing like we talked about. There's the different aspects of the meniscus.
Right, you're hitting a different part of the joint.
Right,
when you do
and then you do this as well. And again, if there's locking, crepitus, or some painful grinding, that would be positive.
All that would
for this
point to that as a possibility.
Right. So those are 3 you can do at home. They're relatively easy. Again, check one knee compared to the other knee, assuming only one is symptomatic. Now, there's 2 of them that I mentioned that I would say avoid. And if you go on the internet, you'll find them. One's McMurray's test, one's the Apley's test. And I'm just going to briefly go through them because they're very distinct.
Yeah, they're too hard for you to apply as a layperson, I would say. And
you can't do them to yourself. You need a second person.
And that second person would really have to know what they're doing.
Yeah. I mean, as a therapist, I used to use McMurray's, and I still do, but I use them in conjunction with the weight-bearing ones, and I feel more confident in the other ones now after I've been using them more.
Sure.
But the Epley one, I'm just going to go through it briefly. It starts up here. There's some rotation.
McMurray's, you mean?
McMurray's, I'm sorry. There's some rotation you have to do, and it kind of looks like this, and you drop it down. And I'm not, like I said, this is what it looks like. I'm not going to go through the details, because I wouldn't suggest doing it.
Right.
Unless you're a therapist. And
then the Apley?
Yeah, the Apley's test, the person lays on their stomach or prone. Now, the thing with this one is if you do it, it's not going to work on a bed. You need something firm. And I usually put a rolled towel up right here so the kneecap doesn't get in the way, because that can be painful. And there's a rotation and pressure going down. And then you're looking for pain as well as some crepitus or locking up with that as well. Both of those I would just put off to the side and, look at them on the videos.
There's no reason that you need to try those when the other ones are.
But if you go to the doctor or the therapist and they do it to you, then you have
then you know what they're doing.
Yeah, introduction to it.
You can impress them by saying, "Oh, you're doing the McMurray's.
Oh, yeah.
You're doing the Apley's."
Well,
and they're like,
Bob and Brad don't suggest I do that to myself. Just kidding. So,
all right.
Very good.
Thanks, everybody, for watching.